We are starting with slide number 57 of the chapter 17 PowerPoint slides. And let me put this in slideshow mode so it'll be larger. Remember the mnemonic sentence that you could say for learning the leukocytes is never let monkeys eat bananas. Down here at the bottom, never let monkeys eat bananas. And if we go by that, the neutrophils they're gonna be phagocytes. So that means that they engulf germs like bacteria. They engulf cells infected with virus and destroy them. And you can see the nucleus, many lobes. It's not rounded. It's just many lobes. And then the eosinophils they stand out because their nucleus looks like earmuffs and they have these red granules. And the eosinophils they're going to start multiplying if you have a parasite infection or if you have worms, So basophils are going to have these purplish black granules. You see them along the edge here. And they do have a nucleus, but a bilobed, meaning two lobes in the nucleus, but you can't really see it that well in basophils, usually under the microscope. So you really just want to look for those purplish black granules. And basophils release histamine during in the inflammatory response. And a lot of times if they release too much histamine, you're going to have the allergic reaction. So lymphocytes are going to be part of our specific immune system. So they help us to build immunity to something. They're going to be involved when we get sick, but we build immunity so we don't get sick from the same exact strain of that virus or bacterial infection again. They're going to be about the same size as a red blood cell, so they're very small. And the nucleus, you see how the nucleus takes up almost the whole space inside the lymphocyte. Monocytes are the largest of the leukocytes, and they're going to have a kidney bean-shaped nucleus, or a kidney-shaped nucleus. And they're going to differentiate into macrophages, which are also phagocytes, but macrophages are slower than the neutrophils. Neutrophils travel a lot faster and they arrive at a site of infection first, usually. They're normally the first responders to infection, whereas monocytes will differentiate into macrophages and they will move slower, but they can engulf a large amount of damaged cells and pathogens. So the granulocytes, again, are the neutrophils, eosinophils, and basophils. Neutrophils are the most numerous white blood cells. They account for 50 to 70% of the white blood cells. They have a lobular nucleus that has anywhere from 3 to 6 lobes. They're phagocytes. Here they are. Eosinophils count for 2 to 4% of all leukocytes. Their nucleus resembles earmuffs. They have red granules, and they help to control parasitic worms. They play roles in allergies and asthma and as immune response modulators. And here you see the red granules in the eosinophils and the earmuff appearance of the nucleus. Basophils are the rarest white blood cell, usually less than 1%. They're known for their large purplish black granules and releasing histamine. The agranulocytes are the lymphocytes and the monocytes. The lymphocytes are the second most numerous white blood cell. They have a large dark purple circular nucleus. They're mostly found in lymphoid tissue, like, for example, the lymph nodes and the spleen, but a few of them circulate in the blood. They are crucial to immunity. There are two primary types, the T cells and the B cells. The T cells act against virus-infected cells and tumor cells or cancer cells, and the B cells produce antibodies. The monocytes are the largest. They have a U-shaped or kidney-shaped nucleus. They leave the circulation, enter the tissues, and become macrophages. So they are active phagocytes. Macrophages are active phagocytes, and they are able to engulf a large amount of viruses, virally infected cells, bacterial parasites, chronic infections. They can clean up they're like the garbage collectors or the cleanup crew of infections. And they are able to activate lymphocytes to mount an immune response. Leukopoiesis, if you remember, erythropoiesis is the production of red blood cells. Leukopoiesis is the production of white blood cells. And leukopoiesis is stimulated by two chemical messengers, interleukins and colony-stimulating factors. All leukocytes originate from the stem cell called the hemocytoblast. Hemocytoblast can branch into two pathways. Myeloid stem cells produce everything, including red blood cells and platelets, and all the white blood cells except the lymphocytes. And the lymphocytes originate from a different pathway called lymphoid stem cells. The precursors to T lymphocytes or T cells move to the thymus and mature in the thymus. The B cells are going to be produced in the bone marrow and mature in the bone marrow. So both types of lymphocytes are produced in the bone marrow. The B lymphocytes mature in the bone marrow, and that's where the B comes from. And the T lymphocytes mature in the thymus, and that's where the T comes from. Now, you don't have to memorize this entire page or this entire picture, but I do want you to see the top three stem cells. First of all, the stem cell that gives rise to all the formed elements of the blood is called a hemocytoblast. That hemocytoblast differentiates into the myeloid stem cell and the lymphoid stem cell. The myeloid stem cell gives rise to all of the formed elements except for lymphocytes. So myeloid stem cells give rise to eosinophils, basophils, neutrophils, monocytes, and then the lymphocytes come from the lymphoid stem cell. The only other cell that I want to show you on here is, and I don't see it, of course, but just remember that before the, oh, I know why I don't see it, because it's not showing you that the myeloid stem cell also forms erythrocytes and platelets, and that's not shown in the picture. But for the erythrocytes, just remember that they start out as reticulocytes, because you can measure the level of reticulocytes in the blood, and that can tell you the amount of erythropoiesis that is going on. So the only thing you're not seeing that the myeloid stem cells also give rise to are the red blood cells and platelets. Now, there are many hematopoietic hormones like EPO and colony-stimulating factors that are used clinically. They can stimulate the bone marrow of cancer patients that are receiving chemo or stem cell transplants. And EPO and colony stimulating factors are also used to increase the protective immune response of AIDS patients. The overproduction of abnormal white blood cells are known as leukemias and infectious mononucleosis. And if the white blood cell is abnormally low, we call that leukopenia. This can be drug-induced. Particularly, we see this with anti-cancer drugs or glucocorticoids like cortisol. Leukemia is a cancerous condition involving the overproduction of abnormal white blood cells. Myeloid leukemia involves any of the descendants of the myeloblasts, so anything except for lymphocytes and cells that become lymphocytes. And lymphocytic leukemia involves lymphocytes. Leukemia is called acute when it is quickly advancing, and it is derived from the stem cells of the leukocytes, primarily affects children. And leukemia is chronic or slowly advancing when it involves the later cell stages, and that is more prevalent in older people. Without treatment, all leukemias are fatal. Now, mononucleosis is a highly contagious viral disease, also known as the kissing disease. It is usually seen in young adults. It is caused by a virus called the Epstein-Barr virus, and it results in high numbers of agranulocytes like lymphocytes and monocytes. And since originally, it was thought that the cells that tended to increase in number were monocytes. That's where the disease was named mononucleosis. But we know now that it also involves lymphocytes. The symptoms are tired, achy muscles, chronic sore throat, and low fever, a low-grade fever. And mono tends to run its course with rest in 4 to 6 weeks. So it lasts a lot longer than, say, a cold or a flu, but does have flu-like symptoms. Now, platelets are fragments of megakaryocytes, and of course, these are derived from the myeloid stem cell line. We also call platelets thrombocytes. So platelet formation is thrombopoiesis, and it's regulated by a hormone called thrombopoietin. Platelets do age quickly, and they degenerate in about 10 days, and the purpose of platelets is for blood clotting. This is a table that summarizes all of your formed elements. You have erythrocytes, you have your neutrophils, eosinophils, basophils, lymphocytes, monocytes, and platelets. Remember, the name for erythrocyte, or the name for red blood cell, is erythrocyte, and the name for platelets is thrombocyte. And remember your sentence. Never let monkeys eat bananas. So that goes with neutrophil, lymphocyte, monocyte, eosinophil, basophil. Never let monkeys eat bananas. Okay, and then hemostasis is the stopping of bleeding. It requires clotting factors, and it involves 3 steps: the vascular spasm, platelet plug formation, and coagulation or blood clotting. The step 1, the vascular spasm, responds to the blood vessels that are injured, respond by vasoconstriction or constricting, and then vascular spasms are triggered by injury to the smooth muscle layer of your blood vessels. The chemicals are released by endothelial cells, which is the lining of your blood vessels. Your capillaries are completely formed from endothelial cells, which are simple squamous epithelial tissue. And so vascular spasms are triggered by injury to the smooth muscle. They're triggered by chemicals released at the injury site and by pain reflexes. Vascular spasms can significantly reduce blood flow until step 2 and step 3 kick in.